But first, a crackdown on pharmacy websites selling popular medicines that are not what you think they are. This week, the Food and Drug Administration shut down 1,600 websites it says were selling illegal, unapproved, or counterfeit drugs. The problem isn't new, but as I found out in my own investigation, it's only getting bigger. Behind too many websites, says the FDA, is this. Counterfeit medications made in Ecuador, Peru, Paraguay, Colombia, China, often in back alley shops under filthy conditions. Now, to get these fakes into your medicine cabinet, counterfeiters have to first get them across the border. Here in Los Angeles, we have one of the largest international mail facilities in the country.
You say the problem's getting worse.
The problem is getting worse. It's on the rise.
Here, U.S. Customs and Border Protection agents are separating out products to be screened with a device called the CD3. It can identify counterfeit drugs on the spot.
Are you able to screen everything that comes through?
Well, we try to screen as much as we can, but because before we would have to send it to the lab, and then that could take weeks. So what we were able to do here, we were able to do in a few minutes.
The National Association of Boards of Pharmacy, or NABP, says that most fakes come through online sales, and that 97% of online sites don't comply with state and federal laws.
They're offering prescription drugs without a prescription. They're selling unapproved FDA drugs, drugs that the FDA has not found safe or efficacious for use in the United States, or drugs that are not even allowed in the U.S. market.
Often the draw is cheaper prices and claims that the drugs are coming from Canadian pharmacies, which most Americans consider safe.
The drugs that they're shipping to consumers, that consumers believe are coming from Canada and have been approved by Health Canada, are really drugs that are coming from places that you would never believe or never suspect.
In the fight to stop fakes, the FDA gets help from pharmaceutical giants like Pfizer. They know counterfeits can hurt the bottom line. John Clark, Pfizer's chief security officer, says his people found counterfeit versions of 60 different Pfizer drugs last year. That's up from 20 in 2008.
Brick dust, wallboard, flour, things of that nature. The better counterfeiters might put in 10, 20, even 30% of the active pharmaceutical ingredient that's supposed to be in the medicine.
The Pfizer lab in Connecticut tests thousands of Pfizer products and packaging a year. It's found fake cancer medicine, fake vaccines, fake heart, fake cholesterol drugs, even fake chapstick.
They'll start with the packaging, do a number of tests to sort of see authentic versus the counterfeit or versus the questionable one. And if the packaging doesn't demonstrate that it's counterfeit, then they actually go to the medicine itself.
This is an audio clip that Pfizer gathered as part of an undercover investigation.
And we can still make $50,000 a month. Well, and that's by hand.
The company shares the information with law enforcement, which then conducts the actual raids and makes arrests. Those counterfeiters were caught, but plenty are not. And joining me now from FDA headquarters, Dr. Margaret Hamburg, the FDA commissioner. Do you know of actual harm to someone taking one of these counterfeit medications?
Oh, absolutely. These products can have none of the active ingredient that people need for the treatment of their disease. They can have too much or too little. They can have toxic ingredients. And they can prevent patients from getting the actual medications that they badly need to treat their disease. Moreover, with certain kinds of conditions and their treatment, substandard drugs, counterfeit drugs, can actually also put us all at risk by enhancing the problem of drug resistance. This is true in a disease like malaria and its treatment. So these are issues that affect people every single day.
Yeah, and I mean, even if they're not getting harmful ingredients, simply by getting inert or inactive ingredients, that can be problematic because they think they're treating their blood pressure, but they're really not, for example. And this week, you announced a crackdown of more than 1,600 websites for illegally selling counterfeit drugs. 1,600 websites. What do you know, when I investigated this before, it seemed like they would have a website that needed to be taken down. They would just come up with another website. How do you make sure these sketchy sites don't just pop up again with a different name?
Well, it's a huge problem, and you're absolutely right. You close one down, and it can pop up somewhere else. We need, relentless attention from an enforcement perspective. We also need to enhance public awareness, and that's part of what we're trying to accomplish, and why I'm glad you're doing this story, because consumers need to know that, sadly, the majority of websites that they're going to encounter when they search the web looking for an online pharmacy are most likely rogue. They are not selling FDA-approved products, and they are operating illegally, and potentially purchasing from these sites put people at risk.
Yeah, and you've mentioned this before, but if you find a site that does not ask for a prescription, is selling a product that they say is not FDA approved, those should be big red flags. And I think 97%, I'm hearing, 97% of these websites could have some sort of fraudulence in that way. When you talk about websites, that's one particular thing, but people use those sites because it's expensive. These medications are pricey. I know even people within my own family have done that.
Right.
Is there something that they can look for on a site that is credible? Instead of saying the sites 97% are bad, we know these ones are good.
Right. Well, that's so important, and there are some things that consumers can look for. Number one, the website should ask for a valid prescription, and if they don't, beware. The website pharmacy should be located in the United States. They should have a licensed pharmacist available for consultation, and they should be licensed in the state where the website is registered by the State Board of Pharmacy. You're not assured of a safe product and a legally operating website pharmacy.
Dr. Hamburg, thanks so much for joining us. Appreciate it.